Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make. Don't lie about the way things are. Tall tales will take you very far. Don't scoff when they say it's the end. In this life, you know you can't pretend. The days pass by, maybe set in stone, but it's not too late now for you to change your tone. Don't speak. Don't speak. Open your soul. Don't harden your heart. Don't speak. Don't speak. Open your soul. Don't harden your heart. Don't bask in a light that's not.
Hey everyone, good morning. It's Marianne from the New York City Organization of Public Service Retirees. So I want to make a few things clear about what we're going to talk about today, and I'm going to try to make this as brief as I possibly can. I know, very funny. So many of you have a drug plan that you currently get from your union. If you have a drug plan from your union, this isn't going to pertain to you. This is only for those retirees who have to purchase a drug plan on the marketplace or from, technically, they typically get it from the city of New York. You purchase the drug rider. And right now, if you're Medicare, that drug rider is $150. Going January, that drug plan will go up to $180 per person. Now, we have been asking OLR to provide us with the formulary for weeks now, and they only gave it to us this past week. We posted it on our website. So if you go to our website, go up to latest developments, you have to go to the tabs to the right. Let me see if I can pull that up so you can see what I'm talking about. When you get to that link, and on your phone, it'll look different because on your phone, you're not going to see all of the options at the top. There'll be like 3 lines to the right. You'll need to click that and then go to latest development. So let me come back to you and share that page so you see what I'm talking about. And once you get there, you're going to go to the latest development page. So here's our website. You'll see up here, these are all of your options, homework, Medicare retirees. Go on this page, on the main page, if you're looking at it long, so like on your laptop or your iPad, it might come out this way. You're going to go to the word more. And when you do that, you'll see latest developments. And here you'll see just an update from us that says OLR extended the deadline to submit your retiree change form to December 15th. We urged them to extend the deadline from November 30th, given that the deadline was on a Sunday after Thanksgiving, and they had not posted the drug formulary and the costing in time, in violation of the law. In preserving your rights, we urge them to post the information on OLR's website and secure us the formulary, which they did yesterday. So this says this was for December 1st. You will find that the senior care drug plan, the senior care Part D drug plan here. So right here, there's a link for you to look at the senior care drug plan, the formulary. However, as of today, and this was December 2nd, and I will tell you as of today, December 4th, they still did not post it to the OLR website, and they still are showing the 2025 formulary. And no, they did not they did not put up the costs of your drugs, and we still know that's in violation of the law as well. Trust me, our lawyers are already on this, and we're going to be doing something else about that later. But This last sentence, the formulary for the NYC EPPO plan is on the tab above. That would be here, NYC EPPO. See this separate tab here, this new plan, or you can click here and, and go there. So we tried to make it easy for you to find the formulary. It's literally just like right up in this first paragraph, because no one else was sharing this information with you, and it is literally in violation of the law that they are telling you that it's open enrollment, and that they wanted you to make a choice of what your plan would be. They're just telling you on the rate sheet your premium's going up $30 a person, but they're not telling you what's in the plan, and they're not telling you the cost. Now, many of you have been calling Prime Therapeutics. Prime has been saying that whether your drugs are in the network or they need a prior authorization, but they're not telling you the cost still, which is still in violation of the law. We gave OLR till yesterday, close of business, which is to tell us the cost. And so now today, I figured you've only got a few more days to make this decision, because you can only purchase a Part D drug plan on the Medicare marketplace until December 7th. Even though OLR is giving you the 15th to do the form, and that's another point I want to make with you, you have to purchase the plan on the marketplace if you want one. And again, remember, this information is only for those people who do not have a union drug plan. If you have a union drug plan, you're welcome to listen, but this doesn't pertain to you, this part, okay? This is only for those people who are purchasing the drug rider through the city. Now, if you go up on our website, you will see that there are two links, one for the base formulary and one for the full formulary. And that's because the plan, the base plan, only covers what they have to cover, but the full formulary, because of the unions wanting other drugs in the plan, they put them into the full formulary. So, and that's really why you're paying $180 a month, is because the plan covers more drugs than it has to. Even on the Medicare D side, it covers more drugs than Medicare says it has to cover. So there might be things like supplements or like erectile dysfunction drugs that they normally wouldn't cover, but because the city union's leadership wanted those drugs in there, it is covered, and that's why the premium is that high, okay? So if this doesn't pertain to you, if you're a healthier retiree and you don't need all of these drugs and you don't want to pay the $180, then fine, you can purchase the plan on the marketplace. The other thing I will update you on is we told you a week ago that we were reaching out to OLR about decoupling the rider. So you saw an October 30th email from the United Federation of Teachers. Mulgrew said that he made this deal that you can decouple the rider, meaning you can purchase a drug plan on the marketplace, because this especially affects you UFT retirees who your union doesn't give you a drug plan like most other unions do. But for those in this situation, Mulgrew sent out an email that said that you can purchase a drug plan on the marketplace. You would still be able to purchase the 365 hospital rider from the city. And that cost us like $3 and change a person. So in doing that, the city says it's either all or nothing. If you have a dependent spouse or a dependent disabled on Medicare, and the both of you are on the senior care plan, then the both of you either have to be on the drug plan or the both of you off. The member cannot be on the drug plan, and the dependent spouse drop off. They're not letting that happen. And we were like, but it's called an optional rider. Like, you should have the option to purchase the optional rider, either as an individual or as a family plan. It doesn't even make sense to even do it the other way, because senior care technically is just 2 times the individual rate, which doesn't make any sense that there's a family plan. It was never done like that. So the city is still arguing that. We asked them, please show us the rule. They didn't. And last week, I told you we wrote to the United Federation of Teachers and we asked Michael Mulgrew and their general counsel, would you please support working with us on fixing this issue? So they wrote back to us a couple days ago and said that they didn't think it was important, or they didn't think it would be a good argument. We wrote them back yesterday and we said, we would really like to work on this with you, since this affects the majority of your members, But if you're not going to, I'll respect your decision and we will go forward trying to fight this on our own, which I don't understand why they would make us do that. But if that's their opinion, I have to respect that. So I'm letting you know, yes, I told you we did it. I told you we wrote to the city. I told you we wrote to the union, to the UFT, and that was their response. I'm waiting for their final, their final answer. And if that's their final answer, well, they're running out of time because we don't really have much time left. But if they don't get back to me today, I'm telling you guys once again, we're on our own without the United Federation of Teachers helping us, okay? Which is why you really need to understand this, because today's the 4th and the 7th is just a couple days away. So all of that said, let me just take a quick look at the chat. Yes, I'm aware that you guys are purchasing drug plans on the marketplace that are like $30 or free, right? Which is why I wanted to make sure that you understood that you could do this and how you could do it. Because it's insane that the people who are negotiating these deals are not doing this, helping us with this. Do we receive an IRMA to cover Part B? Yes, you do receive an IRMA. You pay an IRMA, but you get that reimbursed if you file the form back in October, but not for drugs. The drug plan is completely different. Okay, so, hey, Tommy, good morning. Yes, Mulgrew will take credit for, and I see so was Bennett taking credit for us having negotiated extending the deadline. We extended the deadline because we notified them if they didn't give us the formulary, we were taking our next legal steps, whatever was available to us. So it's very funny. Well, you know, many of the unions, especially UFT, has always wanted to try to take credit for our wins, even in nuanced language, which we think is funny. But if you're not going to help me and you want to take credit for it, okay, well, big deal, whatever. I don't care. You want to take credit for it, take credit for it. But then don't like slam the door in my face, but I'm literally asking you to help. I don't know. Erectile dysfunction drugs will be covered because union leadership wanted it so they can fuck us over better. Yeah, that's a good way of putting it, Ellen. I don't know. All right, so let's get into Medicare Part D. I want to share that page with you. All right, let's set that page up. Let's go to Medicare.gov because that's where we need to be. Medicare.gov. When you get there, the page looks like this. I'm going to pull me out of it to, can I make that bigger? Maybe not. Okay, maybe you couldn't hear me. All right, so I'll go forward. Hopefully you could see this screen. If not, you're going to Medicare.gov, okay? Now, once you're on the Medicare.gov screen, you need to scroll down and it says Find Health and Drug Plans, which you want to click Find Plans Now. And you could either log in if you don't have an account, if you have an account, or not if you don't. I'm urging all of you to create an account, if not now, at some point, like in the very, very near future. This is really handy because you can go in and see what claims are coming through and look at all your information. So I'm going to urge you to do this, okay? But for right now, let's just go here. We're looking for coverage for 2026 plans, and you're going to put in your zip code. For right now, I'm going to put in the Manhattan zip code, and we want just a Medicare Part D. You don't want a Part C, that's Medicare Advantage. No, stay away. You're not needing a Medigap, you have senior care. We just want this middle one that says Medicare Drug Part D. That's it. So we're going to click Find Plans. Now it says, do you get help with your Medicare cost or your drugs? So like, are you on Medicaid, Social Security income, meaning low income, Medicare savings programs, or extra help with drugs? Because we do have, unfortunately, some retirees that do fit in some of these categories. They get LIS, low income subsidies. So they do get help. If that's not you, click this last button down here that says, I don't get help from any of these programs. If you do, click off the corresponding one. Now it says, Do you want to see your drug costs when you compare plans? Yes, of course we do. So you click yes. And it says, great, to see drug costs, get ready to enter the name, dosage, quantity, and frequency for each drug you take regularly. So make sure you got your pill bottles handy because you'll need to make sure you're spelling the drugs right. So let's put in some common medications. And let me if I remember how to spell some of these. So simvastatin would be a cholesterol medication. I'm going to say 20 milligram tablets. Let's take that down a little bit to 10 milligrams. You want 30 drugs, 30 tablets every month. So you're going to add that to your list. Let's add another medication. Let's add a beta blocker. Oops. It would help if I was wearing my glasses. Okay. And we'll change that to 30 every month. Now, you have 2 medications here on your list, but of course, you need to add all of yours. I'm adding some common medications to give you an idea. Now I'm saying done adding drugs because we don't need to get crazy in this example. So now it says here, choose up to 5 pharmacies because it'll give you a map. It'll tell you the 5 pharmacies, these are lower Manhattan, that maybe you want to go to. If it's this AHF, if it's a Duane Reade. So let's see the 5 that it gives me: Mount Sinai Chelsea, CVS, Manhattan Apothecary. So let's add a couple here and add the other CVS there. And then let's add a Duane Reade. Let's see where that one. Okay, so that comes up nearby. Where's that one? Okay, so we're going to add 3, just not to get crazy. And then down here, it says continue to view plans. So now we're going to compare these 3 pharmacies for retail pickup. Now, my suggestion too is if you are on a medication that's considered a maintenance drug, you might want to consider using that medication on a mail order because you will probably get that medication cheaper if you do so. And they'll give you like 3 months at a time, right? So here it'll tell you in health, this is going to tell you the plans that you have available to you. It says Health Spring Assurance. Note that it has 2 stars. So what does that mean? The overall rating of the plan and performance. So that means like there's not a lot of people that like this plan. And it'll also tell you the monthly premium for the plan, which is $35. It'll tell you the total drug cost for 2026 and the deductible, which is pretty standard in Medicare D plans. So it'll tell you to purchase this drug all year round. It's $466. It's total drug and premium. Okay, so this is combining your $35 a month plus your the drugs for those 2 drugs, okay, the cost for those 2 drugs. Now let's go to WellCare Value Script. They have a little bit better of a ranking. It's 3.5 stars out of 5. The monthly premium's $42.40 just for the drug coverage. And for those 2 medications and the premium is $508 and the deductible $615. Then you have WellCare Classic. This also has a 3.5 star monthly premium, $45.70 just for the drugs. Your total drug and premium cost for 26, it goes up to $586, and again, your deductible $615. So now you're kind of getting the idea of how to do this, right? And so now you'll see under each one of these plans, it'll say enroll, which I don't suggest that you click right off the bat, and then plan details. So you can then check also add to compare. So let's say you don't want to compare this like 2-star, 2.5 star plan, or maybe you do. So you'll click compare that one. Let me just make sure I click that. Compare that one. Compare that one, and let's compare the 3rd one, and we're going to compare those top 3 plans. And you'll see when you go to this next page, let me just make sure you're still, yep, you're still seeing what I see. You can then either enroll in this plan, which I don't suggest you do right away, but you can click plan details. So very clearly, it lays out the 3 drug plans you chose to compare. The monthly premium, $35.70, $42.40, $45.70. You can click plan details for each one of these plans. It'll tell you the star rating for them, the monthly premium for them. The yearly deductible is the same across the board. And now it'll tell you drugs covered, drugs not covered, and it says prescription drug covers, restrictions may apply. You can click what that may mean. It'll tell you here that you have to use the generic here, and it'll tell you which is an in-network and which is preferred in-network. So meaning in this, you may most likely get a cheaper rate for that drug at Duane Reade. So now if we go back, it'll tell you the pharmacies there. This is a CVS. This CVS is in network. This CVS is preferred. This CVS is preferred. It'll tell you the Manhattan are all in network, and then the Duane Reades are preferred. So this one CVS over here may not be preferred. Maybe it's an independently owned, who the heck knows. But this gives you all this information at your hands. You know now exactly what the drugs cost, what the premium is, what your deductible is. This is what we've been telling the city of New York that they have to provide you. And I guess they were hoping to try to give it to us within this last couple of days, but they seem to have failed that as well. But if you need more information, you can click plan details. It'll open this page up. There's an overview, drug coverage, and star rating. You can look at some more of the details for each of these medications. It'll actually tell you what the cost is at each different pharmacy, what the cost would be. And it gives you a lot more details. So let me come back to you and see what you have in terms of comments. I thought they were violating the Medicare law. They're actually violating state law. But we're working on that. There may be another issue there, but I'm not going to talk about that online. Our lawyers are handling that. WellCare, which I'm considering, said you need to sign by December 7th. Yes, we've been saying that. All Medicare Part D drug plans have to be registered. You have to register for them by 12/7. The city has to know that you're disenrolling from the city plan, or you've enrolled in this plan by the 15th, or you're changing your healthcare plan by the 15th. They've given you that extension. I'm going to tell you, do that quickly, very quickly, if you're going to do this, because what's happening is you're making the purchase on the marketplace. OLR is lollygagging and not filing the form. They really, all of the managers at OLR need to be fired. Like your commissioners need to be fired because they're not handling this responsibly, intelligently, or timely. And then what's happening is by the time you enroll in the marketplace drug plan, and then you give the city the form that you've disenrolled in their drug plan and that you've purchased one on the marketplace, unfortunately, what's happening is it is disenrolling you from the Medicare Part D plan you just bought on the marketplace. And so many of you have sent us these letters that now you've had to go back and do it again simply because OLR screwed up. So I'm going to tell you, if you're going to do this, file with OLR quickly, right now, quickly, that you're disenrolling. And then wait a day and file to your Medicare Part D drug plan so that it happens after. That might help them a little bit better. And then you may want to go onto the website and shoot them an email that you're disenrolling because you just purchased a drug plan on the marketplace. And please, when you're filling out that form, remember that you need to tell them that you're dropping the rider for the drug plan, but you're keeping the $365 if you want to. Very, very important. Okay. You switch to WellCare. Let's see. Best 2026 Part D drug plan from my research was HealthSpring, formerly Cigna, for 35. And so I'm going to tell you the real DAC. It is dependent upon your zip code. Just because that plan is good for you in your zip code might not be good for someone else. Also, might not cover their drugs. So while I appreciate you sharing what's best for you, this isn't one of those situations because drug costs are dependent upon the contracts that they're from with the PBM, pharmacy benefit manager, and the region in which they are, because prices will vary from region. Okay. Doug Pagnozzi, they hurt their arms patting themselves on the back. That's okay. Retiree and spouse both leave, do they need to switch to the same plan? So if you both, so Janet, I think I understand what you're asking. If you're saying if both the retiree and the spouse leave the city drug plan and you want to purchase a drug plan on the marketplace, no, then you're on the marketplace. If you want one plan and your spouse want another, that's totally okay. That's fine. You don't have to worry about that. Medicare doesn't give a damn what you and your spouse want. It's just this anal Office of Labor Relations that has an unwritten rule that they can't provide us with the rules for, that so far no union has, that we've asked, which was only one, if they would support helping us fix this, decided that they would help us. But hopefully they change their mind on that. If we have Medicare and a union drug plan, do we have to purchase a drug plan? No, I said that in the very top of this video. If you have a union drug plan, this does not pertain to you. If you have a union drug plan, this does not pertain to you. This is only for a subset of retirees who do not have a union drug plan. If you have a union drug plan, you are not allowed to purchase a drug plan on the city website. Now, if you choose you want to drop your union drug plan and purchase one on the marketplace, I mean, that would be a ridiculous decision, especially if you're getting that plan for free. But there are unions, Giovanna, that do not provide their retirees with a drug plan. This is for them because no one is guiding them. Not even their former unions, and sure as hell not OLR. The Commissioner of Labor Relations is completely useless. So I'm sorry to say this to you, but this is why we have to do this, because no one is guiding these people in what to do. But if you have a union drug plan, like I said a million times, this does not pertain to you. I know that's hard to hear, but there are union retirees that their union never provided them with a retirement plan. United Federation of Teachers. So this is a problem. There's managerials who don't have a union. There's policymakers, commissioners, former council members, former mayors. This affects them, not those in a union who have a welfare fund that provides them with a drug plan. Okay. Hi from Sheepshead Bay. Hey, Roberto. MBF not helpful. How do I know if I get better drug prices if I stay with the city plan, especially since my meds will require prior auth? So, Roberta, I still have that problem because the city is not answering that question. This is how negligent they are, that they're ignoring the major fact that the law requires that the city offer a drug plan, that they have to offer you the rates. This is a problem. So I can't answer that question. The city won't give me the rates of all your drugs. My suggestion is that you know what you've paid this year for your medicines, expect that to potentially go up a little higher, compare what you paid last year on the Medicare.gov website that I just explained, enter your drugs and see what the cost would be in comparison to what you paid last year, and then take it from there. And if I do get the costs, I will call you, or I will tell you, or I'll do a video. Should I change if neither my husband and I are taking any medication? So, Patricia, if you're not taking any medication and you're okay with paying $180 a person, that's up to you. I'm not going to make that decision for you. But if you don't want to pay the $180, especially if you're not taking any drugs and you don't have any major health issues, you may just want to cover a plan that will cover you on the marketplace, because you could always go back to the city drug plan if you had to. But that choice is yours, not mine. I take 3 very expensive drugs that require prior auth, and since the city and Prime won't provide costs, it's impossible for me to make a decision on drug plans. And Ellen, I feel you. My suggestion is for those of you in this situation, you go to the OLR website and you email the commissioner directly from the OLR website, because there it not only goes to OLR, it also goes to the mayor's office, City Hall, because they're not that he really gives a shit anyway, but there's some level of oversight because you're emailing them through the city portal. And then they get notified that you emailed them to ask about this, and there's a tracking. What they do with it, I don't know, but it's just another layer that if we had to go back and file a FOIL and say how many people wrote to the city to complain about X, we might be able to have some numbers on our side. But for right now, we don't have this information. All I could tell you is go to OLR website, click email the commissioner, and fill out that form and email them from right there, because that's the best way to let them know that you're not happy about that. Do it twice, the first time with no pharmacy, which will default to Express. This way you will wind up with your favorite drugstore and mail order, and usually cheaper prices. Okay, so if people want to do that again and don't select a pharmacy, then it'll default to express mail, express what? Delivery. I get it, but if they could try that on their own. I don't need to tell them to do that. Or I don't need to walk through doing it again. I'm trying to make this video short. Correct. Decisions. Making decisions is untenable at this point. You might all want to do that. You might all want to go. Let me see if I can pull that up. You might all just want to go to OLR's website and email the commissioner. Let's see. Contact OLR. Okay, let's come back to you and drop this link in the chat. In the chat, I'm putting email the commissioner, and it's going to take you to a page. Go right there and tell them what you think. I think it's about time someone else did that other than me. Ellen Reeser, the Medicare D plan seems less expensive on the premiums, but not sure how that'll work with prior auths or non-formulary meds. Never thought I'd miss those benefit update meetings, but I sure do. So still, Roberta, you should be able to go on their page. There's a phone number for the drug plan for non-members, because you're a non-member of this plan, that you could actually call and ask. So if you're considering switching over, you might want to do that. Go back to that page here. For example, at the top, it says non-members and members. You would be a non-member. Call that 844 number and reach out to them and ask them that question, and you might just get an answer. If you do, please post back somewhere under here and let us know what they said to you. So I, non-Medicare, can't opt into a Medicare D plan for my husband since my dependent daughter is still. So Jacqueline, if you are not Medicare, you can't go into a Medicare Part D plan. The only people this conversation right here is for Medicare eligible retirees who have to purchase a Part D drug plan from the city. This is for them. If you are non-Medicare, your husband will be on your family drug plan for your entire family. And I'm assuming there's you and dependent daughter. So you have a family drug plan. That's what makes your plan different. That'll probably what makes your plan different. And I'm assuming you're all on GHI CBP at this point. That would be another good answer. Okay. Let me just silence my phone. Yeah, your family is going to be on a family drug plan. Okay. Actually, I'll tell you this, though. You have a family drug plan, and even if your husband was not on your drug plan and purchased a drug plan on the marketplace, you'd be paying more because he'd be paying a premium. Right now, he's paying there is no premium for him, I guess, under your family plan. So that's a really good question. Let me take a picture of that, but I do believe my answer is accurate because you're on a family plan with another dependent. There's 3 of you, not 2, which makes that a little bit different. But he would not be in, according to the city's rules, you're either all in or all out. So I think that answers that question. They're not yet letting us split that up, which I really wish that they would, because of situations like this. Your husband would potentially be able to come out, but the city is saying you're either all in the drug plan or you're all off the drug plan. And I will tell you, purchasing a drug plan for you and your daughter pre-Medicare is going to be very expensive if you could find one outside, and it would not be on the Medicare marketplace. I'll tell you that much. Is the new mayor keeping the staff at OLR? I have no idea, but if you can write the new mayor, please let him know he should be firing them too. In addition to the other 179 people he already said he was firing. You can only have one Part D. Be very careful. If you have a secondary under your spouse with Part D, will drop you. Yes. And that's actually what has happened to several other people who have done the same thing. Does the new plan come out of your Social Security check? So, Karen, the new drug plan, if you purchase a drug plan on the marketplace, it will most likely, you'll probably get a bill from the drug plan. I don't know if anyone here is on that, because I am not on a plan like that. I don't know if that comes out of your Social Security check. That's a really good question. But put that in the chat and let Karen and I know, if you purchase a drug plan on the marketplace, are they just sending you a bill, or is the premium coming out of your Social Security check? That's a good question. Let's see if I can find that quickly on Medicare.gov. You guys ask good questions. You can pay for a Part D drug plan through either an automatic deduction from a checking account, or your Social Security monthly bills will be sent by the plan, or by charging a credit card or debit card. Medicare says your total cost, premium, monthly amount that you pay for your coverage, the deductible. You can choose to pay your premium by having your plan deducted from your checking or your savings, charging it to a credit card. Fees may apply. Having your plan send you a bill each month. Some plans will bill in advance for next month's coverage. Send your payment to the plan, not to Medicare. Contact your plan for the payment address. You can also have your premium withheld from your Social Security payment. Contact your plan, not Social Security, and ask them to utilize that payment option. It may take up to 3 months to start. In cases where premiums aren't withheld from Social Security payment until 1 or 2 months after you joined a Medicare drug plan, you will get a bill for the months your drug plan premiums weren't withheld. You will need to pay the drug plan's monthly premium directly to your plan for those months. Great question. There's your answer. Thanks, Karen. Do I have to do anything? Can I keep what I have? Kathy, you don't have to do anything you don't want to. You can keep whatever you want. Do you know if MBF will continue to contribute for some of the drug plan for managers? I do not know. That's a good MBF question. Again, Roberta, if you get that answer, let us know that. I've heard many of you complaining about MBF in the last several weeks. Pharmacies are also vary greatly by region, depending upon the plan, especially if you're nowhere. Yep, I'm familiar with that too. I use Medicare.gov every year to find the cheapest Part D plan. Make sure you put in all your prescriptions and your preferred pharmacy. Do this twice. The first time with no pharmacy, it will default to Express Scripts. This way you will wind up with your favorite drugstore and mail order, usually cheaper prices. Thank you, David. OSA has no drug plan. And I thought that they were actually providing a drug plan. Maybe they were looking into it. Bob was looking into it and then chose not to. Judy, OSA will not give the money to you if you buy on the marketplace. Really? And I don't understand why Bob Krogan made that decision. I will call Bob today and ask him to reconsider that decision, and I will also send them an email on that. I did not catch what you said about the city price rider going up. Okay, so the city drug rider for Medicare Part D is going up from $150 a month to $180 per person per month. I will admit that I am lazy, so I opted to keep things as they are, but luckily my husband and I are currently prescribed no drugs. But to pay $180 times 2 seems crazy. I opted in October to stay the same. Well, Lisa, you still have until December 7th to purchase a drug plan on the marketplace, which I strongly encourage you might want to look at. You don't have to change, but at least you should know what your options are. This is why we educate you and empower you to learn how to do it. It's not being lazy. Get your ass up off the sofa, get your iPad or your computer, sit and do this. Look, I just did this here in 20 minutes. You could do it. It's easy. And then you and your husband could talk about it at dinner and decide what you want to do. Any important instructions on how to fill out the OLR form? Gee, what a great question, Michael. Okay, so let's go back to OLR. Knew you were going to ask that question. There was going to be one. There's always one, Michael. Let's see. Homepage. I want to go to forms. Health benefits, and I want, where's that form? Scroll. Whoops. Retiree, forms and downloads. And I want the retiree change form. Okay, let's put that link in the chat before someone asks about that. Here's the link for that. And now let's share that form. Share screen. Application. Okay. Let's make that bigger. Let's see how that looks. Yeah. Okay. So, if you are dropping your optional benefits, box A would be drop optional benefits. This letter B here is change of, whether you're changing your spouse, which I know many of you probably want to do, dependent children, change of name. If nothing there, just leave it blank. Letter C says change of health plan reason. Either it's the annual transfer period, which if you're looking to drop a rider, that might be your choice. You don't need a once in a lifetime, and you don't need the third one either, moving out of a health plan area. So in letter C, if you're just looking to change your drug plan, it's annual full period. Okay, so that's an easy one there. Section D is just your personal information. That's super easy to fill out. I don't even need to go over that. You should all know that. Domestic partner, spouse, only complete if your spouse, domestic partner is to be covered. So if you're covering them, you're putting them on here, especially if you're dropping your drug plan, you want to know that obviously it's for everybody. Or if you're adding them to it, if you just got married or you had whatever, you adopted kids, or I don't know, whatever you want to add stuff there, goes there. Now, let's drop down to the next page. Non-Medicare plans doesn't apply to you. Medicare supplemental plan doesn't apply to you. Right now, we're literally only talking about the rider, which is at the bottom right here. Here we go. Optional rider right there. Now, you do see this does say with the asterisk based on Union Welfare Fund eligibility, because you cannot purchase the drug rider if you have a Union Welfare Fund drug plan. Okay. So this means you cannot purchase the city's drug plan if the union has one. So optional benefits, check no or yes for optional benefits. If no box is checked, it will be presumed that you do not want the optional rider. So in this situation, many of you are being confused on this question. If you don't want the drug rider anymore, you're dropping the $180 drug plan as of for January, click no. You don't want this. You're going to check that off. If you still want the 365 rider, you're going to click that one because you do want that drug rider. So it's important that you know that this is the plan that you want. Now, you can always send this form in with a letter because you're going to need to either upload it or you're going to need to email it or fax it. Tell them that you want this 365 rider if you do. If you don't, you want to drop it. That's up to you. But that's going to be your choice, okay? You do not want the drug plan, but you do want the 365. Now, the rest of this, you don't need to fill out Medicare HMOs to participate in the drug plan coverage. You're going to want to sign it right here. And then your bottom submission is mail, upload through the portal or fax. My suggestion is you either upload it through the portal and fax it, or you can also, on the OLR website, there is an email. Let me go back to that page. Because if you have any problems, you're going to want to email them at healthbenefits@olr.nyc.gov. That's healthbenefits@olr.nyc.gov. Oh, shit. Oh, yeah, no, it's there. Okay. Hopefully you saw that form. Did you guys see that form that whole time? Hopefully you saw that form. Okay. Now, do I need to notify anyone about the change from what I originally selected? Lisa, I don't know what you originally selected. If you were status quo and you chose not to change anything, you didn't have to fill out a form. If you're doing another one, then the new form that's dated before the 15th would take a precedent, but I would still email the email that I just dropped in the chat and let them know that you previously submitted a form, you are correcting your position, and you're entering a new option. So that's really all you have to do. Okay, perfect. I thought I screwed up and didn't put the form on the screen. I do that sometimes. Okay. Will I switch to Prime? Well, I switched to Prime. George, I don't know what that question means. Well, I don't know, Roberta. Some people might want to change their spouses. You just never know. The change from Express Scripts to Prime is a corporate money grab. Okay, so let me explain that. You will still have Express Scripts. They just changed PBMs. Express Scripts is a PBM. Prime is a PBM. So Optum is a PBM. They're only changing the pharmacy benefit manager. Their job is to negotiate drugs, the cost of drugs, and drugs with retail pharmacies and mail order. Usually they do their own mail order. So my point is in the NYC PPO plan, as well as for senior care, you still have the option. You still have the option of using Express Scripts. That's not going away. It's just they're not the pharmacy benefit manager. That's it. OLR asks date of event. Is that the date of event? That should be the date of event would be. Hold on, let me go back to that. Are you talking about indicate effective date? The effective date is the effective date of the change. The transfer period's January 1. If you're saying date of event, your retiree information, that would be your retirement date. Letter D. Let's see what they say letter D means. Letter D, if you're enrolled in Medicare, nope. Letter D, date of event. Social Security pension number, date of birth. Date of event. I'm thinking date of retirement. I think that's because it says that box is specifically for retiree information. It's asking you your current health plan, the agency in which you retired from, your union welfare fund, date of event. I would put your retirement date there if you know it, or just put month and year. That would make more sense. Do I need to do anything if I stay in the plan? Ellen, you're not giving me what you're asking about. Are you talking about the NYC EPPO? What plan are you opting in? Do you need to opt in if you stay in what plan? If you're talking about, do I need to, if I choose to stay in the city drug plan for Part D, Medicare, do you have to do anything? No, you're not opting into anything. You're just choosing not to leave the city drug plan and continue to pay $180 a month effective January 1. That's your choice, you don't need to do anything. This is only for people who don't want to pay the $180 a month from the city drug plan, who don't have a union drug plan that they have to purchase the rider from the city, and that they don't have any other choices other than either pay the $180 or find a drug plan on the marketplace. If that isn't you, then you don't have to do anything. But there are people that don't want to pay the $180 or can't pay the $180 because you're paying for a high formulary you might not need. That's just the basis of it. I called yesterday. They will continue to reimburse you annually. You have to let them know. Currently, they pay the city $50 a month, and the city credits your pension. So, Lisa Lauren, I'm assuming you are talking about OSA. And yes, nut to UB. Or nut tube. I don't know what you had to say your name, but is it $180 a person or $180 for the family plan? It is $180 per person on the Medicare Part D drug plan. Please, I spoke to David at OSA. You spoke to David. Let me write that down. Hi, I'm getting on late. Do all city retirees have to choose a drug plan for Part D? I have not received anything in the mail except something from Express Scripts. So Lena, I'm going to suggest that you go back and watch this video from the beginning because I'm not starting all over again, but this is only for people that want to change. My husband has an outside drug plan and the premium is deducted from Social Security. Yep. And I did give you that answer right after it was initially asked. I am retired on Medicare with CBP as well as my spouse. We're going to remain on Emblem CBP for the time being. So Joseph, if I am retired on Medicare. You're not on CBP. You are on Medicare with senior care. And that is not the same as CBP. So let's be clear on that. Medicare, I am retired on Medicare as with CBP as well as my spouse. So you're both you and your spouse are Medicare and senior care, and you're remaining on senior care. And you're not telling me about your drug plan, whether you get your drug plan from the city or your union. I can't answer that question. But if you're not changing anything, yes, you're doing it. You're staying right where you are. Yeah. Do we have to use Prime? Well, if you don't have a drug plan from your union and you purchase a drug plan from the city, Prime is the new pharmacy benefit manager. You can get your drugs from Prime, which could also be sent from Amazon, and you can also get your drugs from Express Scripts. George, we have said this like 1,000,001 times. So GHI CBP, I'm going to shift in a second. I'm a UFT member with several prescriptions. As of January 1, will I automatically be enrolled? So Maggie, you're not telling me if you're active or retired, but as a UFT person, if you're active and the NYC PPO plan is not stopped by the court or paused by the court, yes, you will be moving. No, actually, you are in the union's drug plan, whatever that union drug plan is, and I don't know who their PBM is. If you are retired, you will be UFT retired. You are moving into, if the NYC PPO plan is not blocked by the judge or paused by the judge, you will be moving into the city's drug plan if you purchase it, and their PBM is Prime. So I don't know who the UFT drug plan is. I'm not familiar with that. You'd have to call the Union Welfare Fund. George, January 1 is when Express Scripts is switching to Prime as the PBM, but Express Scripts can still be used to get your medications. Okay, let's see. I meant, do I need to notify anyone about the change from what I originally... Lisa, when did you send that in? Did you send it in when you retired 10 years ago, or did you send it in last week? I know you guys have a lot of faith in me, but I am not a mind reader. But if you're changing anything, you need to let them know. That's it. Your Christmas decorations are cute. That's my New York tree. See? I've got taxi cabs and pizza and a hot dog and a pretzel and a crown and an ambulance and a fire truck. Thank you, Jacqueline. Why would someone drop the 365 rider when it's $3 and change a person? It's pretty inexpensive to me. Carol, because it's highly unlikely that it's not just dropping the 365 rider. They're dropping the drug plan. Now, they can drop the 365 rider because remember, Medicare does cover you for a large part of the calendar year. It's just after so many days, Medicare won't cover that. But the likelihood of that happening, of you being in a hospital for like more than 180 days, is highly unlikely. Now, if you do just not care that it's $3 and change a month and just want to purchase that rider as a just in case because it is cheap, many people do that. But I mean, that's an individual choice. I don't judge people on their choices. If they're extremely healthy and don't think anything's going to happen, the chances of you being in the hospital for that long, knowing that hospitals usually try to kick you out pretty quickly. I mean, even after heart surgery or having a baby, you don't stay there. I don't know. It's a personal choice. I'm not going to judge anyone for wanting to drop a $3 rider. When can I find out what price a drug will cost on our plan? Well, Barry, I wish I could tell you. While we're sitting here, let me take a quick check at my email and see if the city actually responded back since I started this Zoom. And the answer is no. So when I'm done, I will call our attorney. Date of event is only for a change of a divorce. See, like dropping a husband or something. Change of spouse. I was right. Or marriage. Yeah, date of event. You're right. That's a good point. Is the date event related to marital status? It could be. I don't really think it's an important thing other than you adding a spouse or adding a dependent child. I'll tell you why that's right, why Michael is right on that. If you're not adding retirement date, because If you're adding a spouse, we just did this with the retiree the other day. The date of event would be the date that you were married if you're adding a spouse to your plan, or dropping a spouse from your plan, the date of event, and you have to provide them documentation. One of the things, so in the state that they were getting married in, wouldn't issue the marriage license, which has to be attached to this document when you're putting adding the spouse, the dependent spouse, to the health insurance. In doing so, the state wouldn't issue it until the date of the event. So they had to go back and go get it, and that would not have been able to have been done in time. So before their marriage date. So they're going to have to, they have to first make the change, and then they're going to have to add the dependent spouse when they could attach the date of event of their marriage. Thanks, Michael. I appreciate you having my back on that one. Yeah. Is the change in the PBM corporate, it's not just that. Remember, they've made certain deals with them, and maybe there was an additional benefit. What about the reimbursement for drugs? Who gets reimbursed for drugs? You if you're UFT, you may get a partial copay reimbursement for medical, but I don't know anyone that reimburses copays reimbursement for drugs. I have prescription. Dickie, again, if you have a union drug plan, this informational section is not for you. I'm a city retiree, UFT senior care. I don't take meds, but my spouse does. Would I be able to drop myself out? The city is not letting just one of you drop off. The city is requiring you both to be on or you both to be off. We are fighting that. And it looks like we're fighting that on our own because the UFT doesn't appear at this time to want to get involved in that fight. But I'm hoping that they change their mind because I would like an ally in this fight. If they choose not to, whether it's the RTC not having any power these days to encourage their leadership of the union, to encourage the city to make this change, we're still fighting this because we think it's the right thing to do. It's also an unwritten rule. It's not in a law. And if it is an unwritten rule, we've demanded it to be in writing somewhere, in which they refuse to do. They just say, this is the way we've always done it. And I said, well, just because you did it that way doesn't make it right. And just because you did it that way doesn't mean it can't be changed. Yet they're ignoring us. So yesterday, 5 o'clock was the deadline that they had to respond to us. Unfortunately, the short answer, Grace, is you're both on or you're both off. And only you can make that decision on what you want to do. Thank you. Getting a drug plan from Local 621. Benefits, retirees, Local 237. And so Local 237, so if William Shenton's listening and some of you 1180 people, you guys remember over the last year, we identified that CWA 1180 and Local 237 did not offer a creditable Part D. Even though they said they did, they lied. And because we exposed it to OLR and we hammered them unmercifully about exposing this, both of those unions had to provide a drug plan, including 237, which is why the 237 plan did change. So Harry and William were going through the 237 drug plan because it does impact them. They noticed that those changes were made. Especially it was very apparent given that there was a low cap on benefit, as well as it did not cover immunizations. Now, vaccinations are covered. There is a whole list of vaccinations covered under Medicare Part D. That was another dead giveaway at the CWA 1180 plan and the 237 plan. So this is how we were lied to by OLR, by CWA, by 237, that their plans were creditable when they in fact were not. So hold on one second. William, I see you're sending me an email. So William Shenton, if you remember, his wife Susan had passed recently, and they were talking about how inexpensive the 365 rider was at $338 a person. Medicare offers this coverage offers more than the hospitalization beyond the 150-day total lifetime Medicare Part A covered stay. He's asking me to tell you. He says, if you or a covered dependent is hospitalized for 150 days, this option would pay up to $37,710. Thank you, William. This is a very expansive description. I'm going to try to read this. The following explains the Medicare Part A hospitalization and skilled nursing facility benefits, Anthem Senior Care, and the 365 rider. Basic Medicare Part A pays for hospitalization for a full 60 days, less the $1,676 deductible, and partially for the next 30 days in a benefit period. A benefit period starts when you're admitted to the hospital and ends when you've been out of the hospital for 60 consecutive days. The 90 regular days of coverage are renewed once you have been out of the hospital for 60 days, consecutive days. There is an additional 60-day lifetime reserve, which are not replenished once they've been used. After using up the 90 regular days and the 60 lifetime days, Medicare will no longer cover your inpatient hospital stay. And it's highly unlikely that many people will be in the hospital for that long. Days 1 to 60, you pay $0 after you met your Medicare Part A deductible of $1,676. Anthem Basic pays the Medicare deductible, except for a $300 deductible per confinement. Anthem's annual family deductible is max $750. From days 61 to 90, you pay $419 coinsurance for each day. This is not covered in the basic Anthem plan. It is covered by the rider, the 365 rider. Days 91 to 150, Medicare's coinsurance is $838 each lifetime reserve day, up to a maximum of 60 reserve days over the lifetime. $419 a day is covered by the Anthem Basic Senior Care, and $419 is covered by the rider. Days 151 to 200, Medicare pays nothing. Anthem Senior Care pays 50%. The rider covers it in full. Days 202 to 365, Medicare and Anthem Basic Senior Care pay nothing. The rider covers it in full. Medicare Part A coverage is in a skilled nursing facility. Anthem Basic Senior Care covers the coinsurance. Medicare coverage beyond the first 100 days at the skilled nursing facility is not available, and the rider doesn't cover skilled nursing facilities. Thanks, William. I'll try to see if I can add that document to our website so people have a better understanding of what that is, because the city, you did actually a better job on that than the city does in explaining it. So if that's for the $3 and change a month per person, or $7 and change for family, if that's something you want to purchase, then you stay on the 365 rider. Ellen, you can't get a Market D plan if you have a union drug plan. Watch the beginning of Marion's video. Thank you, Ellen. Thank you, Marion. I'm going to fax my change right now to OLR. I hope the fax is not busy. And Janet, yes, get that in quickly, especially if you purchase the drug plan on the marketplace, because they need to know if you're keeping, if you're buying the drug plan on the marketplace and keeping the 365 rider, and the faster they do it. Also pay attention, because if they screw this up, and it disenrolls you from the plan you purchased on the marketplace, then we need to fix that, okay? Oh, I love you too, Grace. I'm retired from PBA. Hey, Janet, I don't know what you're asking. If you asked me something before, I don't remember. If you're going to ask me a question, try to put like all the details in one, because I move through this so quickly with everything that's happening. Like if you only saw what my backdrop looks like with all my different devices and the questions coming through from the different places, if you're going to ask me a question and you forgot something, don't just send me back a snippet. Send me back the whole entire question with all the details, or better yet, email the organization. Janet, if your Part D is covered by the union, you do nothing. And she's retired PBA and she has a union drug plan. This doesn't affect her. Retired NYPD on Medicare. Do I have the optional rider? So, Mike, if you are NYPD and you are Medicare and you don't know if you have the rider, look at your pension stub. It'll tell you, because you'll probably find that faster than calling OLR, because OLR is useless. But you could always call OLR if you want to. Can I print the form and scan it and send it. Yes, you can print it and scan it and send it. They're not giving you the email address to send it to, but I did give you the email address to healthbenefits@olr.nyc.gov. It's in the chat and it's on the OLR website. You can send it to them, or you can go to Staples or the UPS store and fax it to them. But that was their question. All right, so we're on this for an hour. Does anyone have any more questions? I want to make sure you guys know how to do this and do your form. Going once. Going twice. Why is everything so convoluted and hard to decipher? An old person, I have enough. And you know what, Roberta, maybe you want to email the OLR website, email the commissioner and tell them that, because they literally could have made this better. I've been begging them in emails to make me an ambassador to their office. If they just shared with me the official information, we could get it out, because they are not. They're not doing their job. They're not doing their job. You can even go and email here. You know what? Let's email Eric today. You guys have no homework to do. Email Mayor Adams. Okay. This is what I want you to do today. Today, you're going to email Mayor Adams. You're going to tell him how OLR is horrible and doesn't give you the information. They haven't posted the drug prices, that they're giving you information last minute, information that is not timely. You can't make a decision. And you want me to be the ambassador to the retirees in an official capacity with OLR, because Renee Campion sucks. That should be your homework today. Not that Mayor Adams will care, but let's see how many of those letters you actually write. There have been complaints about that from that OLR form for years. You know what? And someone asked me if I would make that fillable. So I'll see if I could do that. It might be too late this year, but if I make it fillable, you can fill it out online. You just have to print it out or save it as a PDF and then send it to OLR. So let me see what I could do with that. I'm a Local 3 member with a prescription drug plan that is not Medicare creditable. I assume I need a Part D plan. So, Jeffrey, I'm not familiar with Local 3 not having a creditable Part D. And yes, I would say, because you're probably not getting the coverage that you would need. Like if you went to go get vaccinations and they didn't provide you with that and you had to pay several $100s for a vaccine, whether it's like a flu shot, a shingles shot, or whatever it is, then you're definitely not on a creditable Part D. And if you're I don't know if you're paying for that plan either. If you were to email me with the full information, I actually have a contact in your union that will help me with this, and I can get you a better answer. If you can do that today, I will literally call them today. So if you can give me your name, your contact info, and that what you're paying for the drug plan, if you are paying for it, and that you know it's not a creditable plan, I will call that person today for you. So let me know if you could do that. Our website, our email address is retirees@nycretirees.org. And when you write the email, Bob usually looks at those first. I go in later, but just say, please give this to Marianne, and the team that reads our emails will make sure I see it. Okay. Okay. New York City, GHI, CHP, DO. I start Medicare in January. Do I have a prescription? Dolores, I don't know what your union is. So if you're DOE, if you're UFT, the answer is if you are retiring and you are on Medicare, the answer is no. you'd have to purchase a drug plan for January. That means if you don't want to pay the $180 a month from the city, you'd have to purchase a plan on the marketplace. If you are DC-37, DC-37 offers you a drug plan at no cost. There's no premium to it. So I need to know what union you're in, because you're not telling me that if you're in a union. If you're managerial, then you need to purchase a drug plan. So help me out with that question. Teachers. So you have to purchase a drug plan. Right now, you are purchasing the drug rider from the city because you are retired. If you aren't retired already, started Medicare. So I start Medicare. So you're already purchasing a drug plan from the city because your union doesn't offer any retiree a drug plan. So you may want to look, if you want to purchase the city's drug plan for Medicare eligible at $180 a month, that's great. If you don't, start this video back from the beginning. I show you exactly how to find a drug plan on the marketplace, and then you can compare. I don't know what your medications are, and only you can make that decision. I'm a retired UFT member who wants to keep what they will have. No, if you don't want to make any changes, you don't have to do anything. I'm a retired UFT member I'm a retired UFT member who wants to keep what they will have. Yeah, Michael is asking, are you on Medicare? If you're retired, are you on Medicare? Dolores, Maggie, answer the question. Are you on Medicare or are you on pre-65? You're welcome, Dolores. Hello, Maggie. Janet, you don't need to do anything. You're PBA. PBA has their own drug plan. Again, this plan is only for people. This tutorial is only for people who don't have a union drug plan. I just checked NYCers. It says supplement. $127.50. Not to be, I'm really sorry. Tell me what union you're in again. I know you think I remember this shit, but there's like a million comments scrolling and I don't remember what union you said you were. What union are you? What union are you in? You're going to make me scroll through this, aren't you? No union plan. $127.50. $127.50. It says supplement $127.50. Can you do me a favor and email me with your contact phone number? Because this would be easier to do this way rather than me hold everybody up. Local 15 benefits from 30. Yeah, your union, I wish your union communicates with us. We've tried communicating with your local and they just don't reply. Email me at retirees@nycretirees.org and give me your phone number and tell me your YouTube screen name so that I know who I'm talking about when I call you back. Because that would make more sense. Yeah. The drug rider is $130. I don't know why you're paying $127.50. That's what's stumping me. I'm on Medicare Senior Care. So that's still, let me go. I'm not going to take everybody else's time on this. So not to UB, email me, retirees@nycretirees.org. I will figure that part out. That's an unusual number, and I just want to check the rate sheet to see why it's 127. It's 127.50. Is this the drug rider? Yeah, I'm not sure what that is. The drug rider should be $130, so you're off by a couple bucks. So I'm not quite sure why that number is that number. In the meantime, you may just want to call OLR and ask them for confirmation, because I don't think you're on if you don't see anything else there that says that you're on 365, and usually it would say 365, I don't see that. So let me know what you see. All right. Am I missing anything? I don't think I'm missing anything. Whoops. I'm just scrolling before I end this, just to make sure I'm not missing. And Maggie, you're retired UFT member who wants to keep what they have. Do you have to do anything and you're on Medicare? No, you don't have to do anything if you're on Medicare. Everything stays the same. Just to review, Part A, we check off drop benefits. To drop the drug plan in Part G, no and 365. Yes. And you could even send an email to confirm with OLR that that's what you want to do. You're checking off, no, you don't want their drug plan anymore. If you're on the drug plan, you're dropping the drug plan, but you want the 365 rider. Their form sucks. I'll give you that. Absolutely. Their form absolutely sucks. We've been saying this for weeks. It could have been done better. Maybe that's what we'll do too, is after this is over, like retweak their form and make it fillable, and then we'll send it back to them and tell them to use it next year. But make sure you follow up your wishes with OLR to let them know that that was your intent, is to, if that's what it is drop the drug plan, but keep the 365. You can send it to healthbenefits@olr.nyc.gov. That email is in the chat. Okay. I was told by the union that you stay with Prime. Monthly 50 credit goes through, the pension will continue. If you go to the marketplace, let the union know. They will reimburse you directly, but annually. However, a colleague posted that it won't reimburse you at all. Call them. Okay, so Lisa, I will call OSA. I will probably tell you that Bob will probably scream at me like he always does, but I will get you an answer for that, since we're not getting an official response. All right, guys, I do got to go because I got stuff to do, and I know you guys do too. So do your homework, go back and watch this video. If you're looking to drop, if you are a retiree without a union drug plan and you have to purchase your drug plan on the city OLR website, and you don't want to pay the $180 premium that it's coming to, this video is for you. Everyone who has a union drug plan, you cannot change to the city drug plan. And if you do purchase a drug plan on the marketplace, it will disenroll you from your union plan, which is most likely free. So again, this video is only for people who don't get a union provided drug plan. And this shows you how to get one. All right. I know we're an hour and a half on this, which was way longer than I wanted, but I will look to chop it to just make sure that what you got up in the beginning is the most important information. Now, before I do go, there is one thing that I did just want to quickly check, because if anything changed, give me 1 second. Almost there, almost. Okay, nothing else to tell you. Nope, nothing else. Okay, so guys, enjoy the rest of your day. Thank you. Yes, donate. Thank you, Ellen, for saying that. Thank you for everyone that donated to our Giving Tuesday email that we did send out. We appreciate all of you and your generosity. We're trying to squeeze in everything before before the holidays, because we know that things get really slow up until March, and we want to make sure that we've got enough to keep paying our bills and our lawyers. Retirees at NYC, retirees.org. Okay, it's coming. Retirees at NYC, retirees.org. Okay, so that's what I got, everyone. Enjoy your day. You will see me Friday. I will still do the Friday Live to let you know what's going on, if there's any updates. And I'll talk to you then. Have a great day, everyone. Ciao.
Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make. Don't lie about the way things are. Tall tales will take you very far. Don't scoff when they say it's the end. In this life, you know you can't pretend. The days pass by, maybe set in stone, but it's not too late now for you to change your tone. Don't speak. Don't speak. Open your soul. Don't